So now I'm getting ready to present to the doctor. So when you tell your instructor and the doctor you're ready to present, you want to make sure that your prep area is completely set up. So that means my anesthesia machine is completely set up with the appropriate circuit, and it has been pressure checked with my instructor watching. Again, I have all of my monitoring equipment. My basket is ready for my drug draw. I have all my laryngoscope stuff, my intubation stuff, my blood pressure monitoring cuffs. And then you'll notice we've just pulled the bear hugger back so that he could just sit straight on the table, not the bear hugger. The other thing is you want to make sure the paperwork is prepared. So before this time, you should have received a drug sheet from your instructor that tells you which drug volumes we're going to be using and also your drip rates. You want to make sure every sheet of paper in the chart has the patient's name and is filled out appropriately as much as you can. You want to have pulled out your anesthesia sheet because you will need this for monitoring. Again, I have it filled out as much as possible for now. And then we will also give you an emergency drug sheet, which should be kept right directly under your anesthesia sheet so your assistant can go to it immediately in case of emergency. Under that, I had my assistant prepare my tapes for me so they can do your half-inch tapes tabbed on both sides with the drug names. If you already know ahead of time what drugs you're using, that's fine. This is also something we may do after we present, so we'll discuss that. The other thing I do want to note, as far as being prepared to present, is there is a space here for a pre-operative TPR. I'll also put in my fluid rates right now. So after my assistant has brought the patient out, we would get a pre-op TPR so that we know what his baseline numbers are before we give him any drugs. I will go ahead and write in my fluids. My fluid type is always going to be LRS. His surgical rate is 36 milliliters per hour. You want to write that, and then we'll calculate his drip rates. So now that I have all of that ready, I am now ready to present. Doctor, I'm ready to present. So when you present to your doctor, the first thing you want to do is go over signalment. So, Pepper is a 1-year-old intact male Lhasa Apso Shih Tzu mix. He is, he's presenting today for an orchiectomy. Pepper was given as a gift to the owner's mother with no previous history known, unsure about puppy series of vaccines or any parasite control. Currently, Pepper lives with a 4-year-old Labrador as an outside to potty dog. He's fed 1 cup of kibble, Eukanuba brand, twice a day, and is on an unknown flea product. Pepper was vaccinated against Bordetella on 9/8 of 18. Rabies was given on 12/15 of 18. And his distemper his DA2P and lepto was given on 1/5 of 19. There is no history of coughing, sneezing, vomiting, or diarrhea in the past 48 hours. The owner notes some behavioral issues, like he licks the inside of other dogs' ears, and he will hump them. He has not shown any aggressive behavior. After you've given your signalment and your subjective information, you'll then go over your physical exam findings. We don't have anything obvious for this patient, and the doctor's doing her initial exam right now. But ideally, you go over those things, and Dr. Kamaka may ask you specific questions on some of the things that you have found. After she's done with her physical exam, I will give her the chart so that she can look through blood work.